Intramuscular injections are an important part of nursing practice and a skill that every nurse must learn. This program will identify the supplies needed for giving an intramuscular injection, illustrate the landmarks for sites used, and demonstrate the Z-track technique for giving these injections. Intramuscular injections are given deep into the muscle tissue. This route is typically used to administer medications that require a relatively rapid absorption of large volumes of medication, up to 3 milliliters in the adult. Decontaminate hands before and after the procedure using acceptable aseptic practice as indicated by agency policy. Gloves should also be used. Follow the 6 rights of medication administration: right patient, right medication, right dose, right route, right time, and right documentation. Supplies necessary for an intramuscular injection include safety needle and syringe, alcohol pad, bandage, cotton ball, gloves, appropriate medication, and the medication administration record or computer printout. Needle gauges for intramuscular injections range from 25 to 20 gauge. Needle gauge is determined by the viscosity of the medication being administered. Needle lengths range from 1/2 inch to 3 inches. Commonly used sizes are 5/8, 1, and 1.5 inches. Needle length is determined by the size of the muscle and the amount of subcutaneous tissue over the muscle. A 3 milliliter syringe is frequently used for intramuscular injections. Syringe size is determined by the volume of medication to be administered. Injection angle is also an important consideration when giving an intramuscular injection. Injection angle is 90 degrees to the muscle being injected. To facilitate needle insertion and to ensure injection into the muscle tissue, stabilize the tissue at the injection site. If the patient has a small muscle mass, the tissue is bunched to accommodate the injection. When giving intramuscular injections, it is recommended that the Z-track technique be used to minimize pain and to reduce leakage of medication into subcutaneous tissue. The Z-track technique must be used if injecting irritating medications, such as hydroxyzine hydrochloride, and is recommended for all intramuscular injections. The Z-track technique involves the displacement of the skin and subcutaneous tissue. The displacement prevents tracking of medication out of the muscle tissue. When using the Z-track technique, the needle may need to be changed after drawing up the medication so that no medication remains on the outside of the needle. Check agency policy. The Z-track technique is recommended with all intramuscular injections and will be shown with all 3 injection sites. When selecting an intramuscular site, the nurse needs to assess the size and condition of the muscle, the age of the client, and the type and volume of the medication to be administered. The 3 sites most often used for intramuscular injections are the deltoid, the vastus lateralis, and the ventrogluteal. The deltoid site is easy to access. It is usually a small muscle and can only accommodate small volumes of medication, up to 1 milliliter. Landmarks for the deltoid site are the acromion process and the axillary line, midpoint with the lateral aspect of the upper arm. Identify the acromion process, and depending on the size of the muscle, locate the area 2 to 3 finger widths below it. Select a site in the middle of the muscle, above the mid-axillary line. The vastus lateralis is a well-developed muscle. This site is free of major nerves and blood vessels and accepts large amounts of medication. Landmarks for the vastus lateralis site are the head of the greater trochanter and the knee. Divide the area into thirds and use the anterior lateral portion of the middle third as the injection site. The ventrogluteal is also a well-developed muscle and the safest site for injection. This site is free of major nerves and blood vessels and accepts large amounts of medication. Landmarks for the ventrogluteal site are the head of the greater trochanter and the anterior superior iliac spine. With the thumb pointed toward the abdomen, place the palm or heel of the hand over the head of the greater trochanter. Place the tip of the index finger on the anterior superior iliac spine. Move the second finger along the iliac crest to form a V. The injection site is located in the middle of the V. Locate the landmarks, the acromion process, the axillary line, midpoint with the lateral aspect of the upper arm, and choose the injection site. Clean the site with an alcohol pad using a circular motion moving outward for about 5 centimeters. Allow the alcohol to dry. Use the non-dominant hand to displace the skin and subcutaneous tissue 1 to 1.5 inches to one side of the injection site. Use a smooth, darting action to insert the needle at a 90-degree angle. Continue to hold the tissue taut with the non-dominant hand. Stabilize the syringe. This prevents the needle from moving and traumatizing the tissue. Aspirate by pulling back slightly on the plunger for 5 to 10 seconds. Aspiration verifies that the needle is not in a blood vessel. If blood is seen, withdraw the needle, discard the syringe, and begin again. If no blood is seen, slowly inject the medication at a rate of 1 milliliter per 10 seconds. Wait 10 seconds. Then quickly and smoothly withdraw the needle at the same angle that it was inserted and release the subcutaneous tissue. Cover the injection site with a cotton ball or dry gauze. Massage only if indicated, as with certain drugs such as the cephalosporins. Immediately dispose of the needle and syringe in a sharps container. A bandage may be used on the site if there is any bleeding. For the vastus lateralis site, position the patient supine with knees slightly flexed. Locate the landmarks: head of the greater trochanter, knee. Identify the middle third portion of the muscle and choose the site. Clean the site. When the alcohol is dry, stabilize the tissue at the injection site. Insert the needle. Stabilize the syringe. Aspirate. Inject the medication and wait 10 seconds. Withdraw the needle, release the tissue, cover the site, and dispose of the needle and syringe. For the ventrogluteal site, position the patient on his or her side or back with the knee and hip of the leg flexed. This will help relax the muscle and reduce discomfort. Locate the landmarks: the greater trochanter, the superior iliac spine, and choose the site. Clean the site. Use the non-dominant hand to displace the skin and subcutaneous tissue 1 to 1.5 inches to one side of the injection site.
Okay, on the count of 3. 1, 2.
Insert the needle at 90 degrees to the muscle. Stabilize the syringe while maintaining tissue displacement. Aspirate. If no blood is seen, slowly inject the medication. Wait 10 seconds. Withdraw the needle and immediately release the skin so the medication cannot escape the muscle tissue. Cover. Only massage the site if indicated. Dispose of the needle and syringe in the sharps container per agency protocol. On the correct patient record, document each intramuscular injection. Indicate time, medication, dose, route, site, and any adverse reactions or complications. The medication administration record, or MAR, is completed by the administering nurse.
Rotation of sites is recommended when a patient is receiving frequent injections. Follow your agency's policies and procedures when administering and documenting intramuscular injections.